What I want to show you here is one of the ways you can use the inherent flexibility of the tissue in the breast in the way that you can't in the liver and the thyroid to be able to get your needle into the right place. So imagine we're looking down onto the breast here, and here is the lesion that we're trying to biopsy. So we go in with our needle, and we find that our needle, which happens quite often, is on the edge of the edge of the lesion rather than through the center of the lesion. Here's our transducer here. Now, sometimes we can just sort of push the needle away from us and get into the right position, but sometimes that doesn't work. Everything, the lesion pushes away with us as well, and particularly in patients who have dense breasts. So another way of doing it is we can rotate both the needle and the transducer using the lesion here as the fulcrum, the center of the rotation point. Here we're on the lesion is away from us, or the needle's on the near side of us. And what we're going to do is we'll rotate the hub of the needle towards us. We'll rotate the transducer away from us. And you'll see then that our needle is now straight through the center of the lesion. And this works incredibly well. Now, what about the opposite situation where the needle is on the far side of the lesion rather than the near side of the lesion? Well, we just do the opposite. Instead of rotating clockwise like we did previously, this time we're going to rotate counterclockwise, and again we'll end up with our needle in the center of the lesion like that. So just to reiterate, if the needle is towards us, so the lesion's away from us, and we scan back and forth, we're going to rotate everything clockwise. When the needle's on the far side of the lesion, away from us, we're going to rotate counterclockwise. One of the advantages that we have in the breast as opposed to in the liver or thyroid biopsy is the flexibility of the breast, although sometimes it's a problem for us, can actually help us localize on lesions. So here she's actually at the edge of one of the lesions rather than centrally. And so there's a number of things you could do. You could come back and completely re-aim, but sometimes that's a pain. You can try and push towards yourself or pull towards yourself, but sometimes the whole lesion moves with you. Or you can rotate both of your hands. So she is going to rotate both her transducer and her needle using the lesion, scan a little bit towards the olive, Nicole, using the lesion as a fulcrum. You can now see she's right at the center of the mass, and I'm going to show you how that looks with a hand motion. So you see here that she's worked out that her, in this particular case, that her needle is on the far side of the lesion away from her, and she's now going to rotate both the needle and the transducer in a clockwise direction. Looking carefully at the screen, you can see the lesion's the center of the fulcrum. Now, if her needle had been on the near side of the lesion, she would have moved it exactly the same, but in an anti-clockwise direction like this. So again, the needle is on the near side of the lesion, it's towards you. She's going to rotate the needle and the transducer as a unit, with the lesion being the fulcrum, and that will line it up nicely with the center of the lesion as shown on the diagram. Sometimes in a very dense breast you just can't get that trocar forward without using excessive force, which gets a little scary to the patient as well as yourself. You're aiming towards the chest wall. In this case, put the trocar as close as you can get it, aim towards the needle. We're still a couple of centimeters away, and so aim towards the lesion, get your needle and deploy the needle. Now, realizing that we're actually not going to be anywhere close to that lesion. Now you see we're still just, our needle tip hasn't even got to the lesion. While the needle is still in the patient, push the cannula forward until it gets to the place you want. Then take the needle out, throw the biopsy in the pot, realizing it's probably just normal breast tissue. And now when she takes that needle out, scan across there, Nicole. Oops. Now before you take the needle out, what you're going to do is stabilize the needle and push the cannula forward a couple of centimeters. You'll see that it glides now pretty easily through a dense breast. Then take the needle out. And now when we look at where the cannula is, we can now see it's right up against the lesion in the correct position.